Hi, I'm Dr. Jarrod Frank, Director of the 5th Avenue Dermatology Surgery and Laser Center. Welcome to one of my educational videos. Today, we'll be talking about the perioral or mouth area. This is an area where we've been treating for years, mostly with fillers. Unfortunately, over time, there have been several limitations for certain types of lines, the fine lines around the upper lip, which is a very common area of complaint for women. We've tried fillers in the past, but up until recently they failed due to complaints of lumpiness and irregular shaping of the lip. Traditionally, we've always used rather aggressive laser resurfacing to improve this area, and although it works, it's very rare that patients can find the up to a week downtime that's associated with getting those little lines better around the mouth. As of recent, we've had some advances. We've tried new ways of using Botox and also have some newer fillers, one of which I've talked about before on my videos is Belotero. Now, Belotero is a hyaluronic acid filler, similar to Juvederm, similar to Restylane, but the formula is a little different. It's kind of like Coke, Pepsi, and Shasta. It's very thin, and it's more similar to the old collagen that we used. It was able to fit into the very, very fine lines without leaving lumps and bumps. I found this to be very effective around the mouth, and as with many things, we get the best cosmetic result by combining small procedures. So I found for those patients who don't want to go in for more aggressive laser resurfacing, a combination of Belotero and Botox around the mouth has really given a home run result. So this is Geraldine over here. She's a long-time patient and a good friend. We've been treating her for years. She's been in our videos before, and she's been complaining about these upper lines. We've used fillers elsewhere, but if we could come in real close, she's not even a smoker, but this has been a concern for her. So but she was. But anyway, I'm going to use Belotero in this area and around the mouth for these little lines that the thicker Restylans and Juvederms can't get. After that, I will then inject very small amounts of Botox into the muscle of what we call the oral sphincter. And what will that do? That will actually relax the muscle enough to reduce the wrinkle, but not so much to affect the motion of her mouth. She needs her mouth. So, let's inject a little around here. Here we go. There is a little Novocaine-like anesthetic in the filler, so although she feels it, even with topical anesthesia, over time, she will feel it less and less. So I inject the general area. I could also inject with very specific wrinkles. I always like to get the fine lines in the corner of the mouth. This filler, Belotero, is layerable, meaning I can use Restylane, Juvederm, Radius, Sculptra, any other filler in the deeper areas, and then layer this on top as almost like an icing on the cake. Very good. She's being very tough. Good. So as you can see, it's pretty atraumatic. Already you're starting to see some differences in the finer lines. And just for presentation's sake, I'm just going to treat this one side, and after I've done the Belotero, which I've just completed, I'm just going to put 2 small kisses of Botox deeper in the muscle. I'm not actually filling a line, I'm putting it deeper in. Afterwards, she can resume regular functional activity, exercise. It doesn't really change the shape of the lip or the size. That's what everyone's big concern is. I don't want duck lips, Dr. Frank, when treating these lines. So it's something that you can do without affecting the shape or the size of the lip, and it will make a very big difference. Like all fillers and Botox, it takes a few days to settle. Often I see patients back about a week later to make sure they're okay and see if they need any touch-up. But this is a very tolerable, very simple 1-2 punch for the treatment around the mouth. And again, it goes very, very well with several other things. Belotero could also be used in very popular areas like necklines, horizontal necklines, chest lines. We finally have a filler that we could fill in those nooks and crannies like we never did before. So it has a lot of uses, and it's proven to be a real winner in addition to the filler field. Thanks for joining us, and you can check out more information on our website at pfrankmd.com. Thanks for joining.